Pharmacists and other healthcare professionals can address antibiotic resistance in a lot of different ways. Truthfully, the most important one is to decrease the overall amount of antibiotic use. And by that, I don't refer to not using it in cases where the agents need to be used, but by decreasing the overall numbers of times that they're being used. There are studies that show in hospitals that at least half of antibiotic use is not truly justified. But it started because of fear and legitimate concern of a diagnosis that's not certain. Someone comes in with a fever and difficulty breathing and so forth. It's reasonable to suspect pneumonia and to start antibiotics because of fear that you're going to miss something, and that's justified. But that use, every single time an antibiotic is used, the chances of resistance increase. And if you think about it, antibiotics are the only class of medications that use in me affects their utility in you or in anyone else. So there's no other medication, like with blood pressure medications, where if you give them to one person, it doesn't matter to another one. Antibiotics, it does matter. So the single most important thing we can do is to decrease the overall use as much as possible. And obviously the best way of doing that is by decreasing the proportion of that is inappropriate.